Welcome to this comprehensive guide on the neonatal period, essential preparation for exams like NORCET, RRB, ESIC, and DHS. We will focus on key concepts, including definition and classification, physiological adaptations, immediate care, APGAR scoring, vital signs, common disorders, and rapid-fire terminology. A neonate is defined as a baby from birth up to 28 days of life. The early neonatal period is 0 to 7 days, which is the most critical period for survival. The late neonatal period is 7 to 28 days of life. The classification of newborns by gestation is an important concept in neonatal care. Let's run through some rapid-fire terminology. The normal birth weight in India is 2.5 to 3.0 kilogram. The perinatal period spans 22 weeks of gestation to 7 days after birth. Normal length is 50 centimeters, and normal head circumference is 33 to 35 centimeters. Immediate care at birth involves 5 steps. First, clear the airway, suctioning the mouth before the nose. Second, ensure thermoregulation through drying and skin-to-skin contact. Third, assess the APGAR score at 1 and 5 minutes. Fourth, provide cord care, preferring delayed clamping. Finally, ensure identification with an ID band. APGAR scoring, developed by Dr. Virginia Apgar in 1952, assesses appearance, pulse, grimace, activity, and respiration. Interpretation of the APGAR score guides the immediate management and required interventions for the newborn. Let's review a previous year's question. A newborn with a heart rate of 90 BPM, weak cry, some flexion, grimace on suction, and pink body with blue extremities has an APGAR score of 5. In newborn anthropometry, normal weight is 2.5 to 3.5 kilogram. A 10% physiological loss occurs in the first week, regained by day 10. The birth weight should double by 5 months and triple by 1 year. Normal length is 50 centimeters and increases by 50% at 1 year. Head circumference is 33 to 35 centimeters, measured at the occipitofrontal prominence. Chest circumference is usually 2 to 3 centimeters less. At birth, head circumference is greater than chest circumference, but they equalize at 1 year. Normal vital signs include a heart rate of 120 to 160 beats per minute, respiration of 30 to 60 breaths per minute, and a temperature of 36.5 to 37.5 degrees Celsius via axillary measurement. Newborns cannot shiver to produce heat and rely on non-shivering thermogenesis using brown adipose tissue located at the scapula, axilla, kidneys, and neck. Hypothermia, defined as a temperature below 36.5 degrees Celsius, is a silent killer. The 4 mechanisms of heat loss are evaporation from wet skin, conduction via cold surfaces, convection through air currents, and radiation near cold objects like walls. The most common method of heat loss in a newborn immediately after birth is evaporation. Respiratory adaptation is triggered by chemical stimuli, mechanical chest compression during delivery, and surfactant, which prevents alveolar collapse. An LS ratio greater than 2 to 1 indicates lung maturity. Transitioning from fetal to neonatal circulation involves significant changes to the cardiovascular system. Here are more rapid-fire physiology facts. Breastfeeding should start within 1 hour of normal delivery. The newborn stomach capacity is 30 milliliters on day 1. RBC lifespan is 60 to 80 days, and physiological jaundice peaks on day 3 to 4 for term newborns. Primitive reflexes are important. The Moro reflex, or embrace reflex, disappears around 3 to 4 months. The rooting reflex causes the baby to turn its head toward a cheek stimulus. Other important reflexes are routinely assessed during the newborn exam. The absence of the Moro reflex in a newborn may indicate brain damage or a clavicle fracture. Neonatal stool types begin with meconium, dark green, and sticky, passed within 48 hours. Transitional stools follow on day 3 to 4, and then milk stools, which are yellow-gold for breastfed infants. Physiological jaundice appears after 24 hours, peaks at day 3 to 4, and resolves by day 7 to 10. It is caused by an immature liver and high RBC destruction. Pathological jaundice appears within 24 hours, with bilirubin levels exceeding 15 milligrams per deciliter. Causes include blood incompatibilities, and the danger is kernicterus, or brain damage due to bilirubin. Phototherapy uses blue light to convert bilirubin into a water-soluble form. Nursing care includes covering the baby's eyes and genitals, exposing maximum skin, ensuring hydration, and turning the baby every 2 hours. Jaundice appearing within 24 hours of birth is considered pathological. Various types of scalp swelling are classified as birth injuries. Neonatal hypoglycemia is defined as blood glucose below 40 milligrams per deciliter in a term infant. Risk factors include diabetic mothers and prematurity. Symptoms include jitteriness and poor feeding. Management starts with breastfeeding or IV 10% dextrose if severe. Neonatal sepsis features include hypothermia or fever and lethargy. Early onset sepsis, within 72 hours, is often vertical transmission. Late onset sepsis, after 72 hours, is usually hospital or community acquired. Kangaroo mother care, recommended for low birth weight infants, includes skin-to-skin contact and exclusive breastfeeding. Benefits include better temperature regulation and reduced infection. Colostrum, the first milk, is rich in antibodies. Foremilk quenches thirst, being rich in protein and sugar. Hind milk satisfies hunger, as it is rich in fat. Vitamin K is administered to newborns to prevent hemorrhagic disease of the newborn. The umbilical cord contains 2 arteries and 1 vein. Physiological weight loss in a term newborn is about 10%. The anterior fontanelle normally closes between 12 to 18 months. For quick revision, witch's milk is due to maternal hormones. Mongolian spots are normal blue or gray spots. Epstein pearls are normal white cysts on the palate. Milia are normal white pinhead spots on the nose. Key golden points include normal BP of 60 to 80 over 40 to 50 millimeters of mercury and vitamin K administration site in the vastus lateralis muscle. Hypothermia is known as the silent killer. In summary, remember APGAR at 1 in 5 minutes, the DWAB steps of care, normal vital signs, and alert signs like jaundice within 24 hours. Prevention includes vitamin K and timely vaccinations. Thank you for watching this video. All the best for your exam. This scene displays the image sources used throughout the video.